Hi, I'm Michelle Camo, Director of Leader Development with the Wisconsin Institute for Healthy Aging. Thanks for joining me today for a short conversation about program outreach. So there are many ways to do outreach, and what's effective here may not be effective there, or what resonates with this group or that program may not connect to another group or even make sense for a different program. Therefore, today I'm just going to talk about strategies and practices to consider when making your outreach and marketing plan. And since this is on WeHa's YouTube channel, I challenge you to be thinking about your experience to share with us or a question to ask in the comment section down below. We want this platform to be a two-way dialogue for our program providers and our leaders to connect and learn beyond just what the content that WeHa is putting out. Okay, so as we settle into this information video, let's talk about some of the basics, like why do we do marketing? What are our goals or our intentions? And then what does creating a strategy around those plans look like? So to begin, that first column, why is outreach needed? Well, marketing your program is really important to make everyone aware that this resource or program exists and is available to them or to help someone that they know. When your program awareness is strong and you're out and about in the community, being present at events, or even in those community spaces, you build your programs and your organization's credibility. And this is where creating a strong local implementation team has its added benefits. When you have partners sharing your product and supporting your program, information, awareness, and demand can spread more rapidly. And then marketing is an investment, and it's a really important investment. Yes, this investment takes time and resources and sometimes additional funds, but it's really necessary. Have you heard of the rule of seven? Well, the rule of seven is one of the oldest concepts in marketing. The rule of seven simply says that the potential client needs to hear or see a marketing message at least 7 times before they actually act on that message. And in today's fast-paced, info-consuming environment, I wouldn't be surprised if that number is actually higher. But I mention this because it shows that we need to invest in various tools and strategies to get our message out there. So you need to consider diversifying people and organizations on your implementation team, the ones that serve various populations, so we can expand where our ads are being placed, how our awareness is being generated, and then having those different groups learn about our great programs. So our next column is our goals. So two main goals with program promotion. There's building the awareness to promote your programs overall, and then there's registering people to promote an upcoming workshop. So both are really important. And when you're doing these, you'll most likely use different strategies to accomplish these goals as separate goals. It's important to be very clear about what this goal is as you move forward in choosing your strategy, whether it's just promoting your program overall, or if it is to build and fill a specific workshop. And we'll get into that shortly. So next we need to develop our outreach plan. So who is your audience? Who is the target audience for the program that you're trying to work on? Where do they live? Where do they congregate? What do they care about? And how do they get their information? Based on these answers to those questions, you're going to plan your messages and your communication strategies. And WeHa has created materials that you can use with messages that have already resonated with past participants to really save you time and effort in making these. But you still need to adapt or modify them to meet the interests of your population. So next you need to utilize your partners. So you need to develop key relationships. It's really critical to create a robust channel of communication and referral sources. So some of these relationships will be already a part of your network or even on your implementation team, while others, like community champions, might be on the peripheries, and maybe they help out when programs are based in a specific location, where they can help access a certain group when some workshop is happening or occurring nearby. But remember, relationships are a two-way street. Be just as much a part of their promoting of their resources and their events as they are with helping you. And you need to start early with your plan. Don't wait. Start getting the word out about 8 weeks in advance of your workshop. You want to reach out early to your agencies and your organizations with your asks, like your nonprofits, your religious groups, your aging units, educational departments or extended ed, and public health, and even your leaders, because all of these people are serving different target audiences to help get the right people in the right program. Do your marketing with regularity. Use regular announcements and event listings in the newspaper as a complement to the awareness generated by face-to-face presentations and marketing. Market your programs all year round to continue building that awareness and build that demand all year round, because that rule of 7 is real. So it's important to continue to engage people regularly. Create a list or a database of people, partners, community organizations who are interested in the program and the resources you have to offer. Keep building on this list and keep sending messages to those individuals on that list, either by phone or email or regular mail, because these are your best prospects and your best champions. And then you're going to want to track your strategies. Systematize your program outreach. Develop a plan, evaluate after each workshop, and evaluate that outreach effort, and then replicate those methods that are successful. And don't be afraid to try new things. See what works and what doesn't, and then evaluate and adjust, kind of like an action plan. Every community is different and has different assets, so if one promotion method doesn't work well, just try another. Also, in addition to thinking about what you're doing to promote your program, consider how you are doing it. Is it with enthusiasm? Are you being engaging and speaking in the right way to your audience? So are you talking about data and the love of numbers and how it impacts the wider audience? Or do you need to come from the idea of the story or the feel-good camp who loves testimony? Or is it a mix of both? But we could do a whole nother video on this, so let's continue. All right, so let's talk about some ways we promote our programs. So the following ideas have been generated in a real brainstorm by real leaders and program providers about ways that they do outreach for various programs. So the brainstorm is ways to promote your upcoming program. Email to past participants, Facebook, social media, newspaper ads, press releases or free media, letters to the editor, various newsletters like senior centers, clinics, community newsletters, etc. Targeted mailings, so that's from the healthcare provider's office to patients directly. Radio station shows and ads, friend referrals, flyers at the pharmacy, at the laundromat, and maybe in the elevator, bathrooms, exam rooms, coffee shop bulletin boards, grocery stores, etc. We really love our flyers. Personal invitations, health fairs, waiting rooms, presentations, brochures, personal letters, call people on my waiting list, direct referrals from health providers, email blasts to various partners, and email leader lists. And then we also have other ideas here. So that is quite the list. If you have other ideas that maybe we didn't put on this brainstorm, I recommend that you just kind of jot those down, because we're going to set this list aside for a minute and look at the two forms of marketing strategies as it relates to promotion. All right, so we have two categories here. We have our passive marketing and our active or proactive marketing. And this is a way that we can categorize our strategies into two forms. And I want to be clear, both of these are really great. Both of these are really necessary strategies to use. But what we've noticed is that one gets way more use than the other. And I'm looking at that passive marketing. And sometimes, due to time restrictions or whatnot, we don't do any of those proactive approaches. And when we don't invest in a diverse plan of action as it relates to our outreach, our programs will suffer. It's harder to get people to hear about it, to know about it, and to get registered. So it's really important to invest in both stylings of our strategies. So let's define each of these and then give some common examples. So with passive marketing, it is a long-term way to be around in the community. It reaches people through smart positioning and it's premeditated. So for example, a person may use a search engine to locate a resource and your organization pops up. That marketing was done before the need arose. There was no special event that was required. Or maybe creating an eye-catching flyer to be placed around town for people to call you. That passive marketing is thoughtful and it's anticipated. It takes work and it takes planning, such as creating good informational articles about your program, or having inviting, motivating material, or maybe being listed on a directory or having strategically placed ads, flyers, and brochures in community spaces. It's information that's going to sit around for a while without further effort. The issue is these items are just kind of hanging out. You see my laid back dude icon there. They're just kind of waiting for a person to search them out, to come across it, to pick it up, to read it, While us program providers are over here just crossing our fingers and we're really hoping that our well-positioned, thought-out marketing is seen and read, but also acted on. Remember that rule of 7 we talked about, that it takes 7 times? Well, we're over here hoping that that person calls us to learn more and to register because of that passive marketing that's out there. So that's where proactive marketing is different. With proactive marketing, it requires more action from us. It's deliberate and purposeful, and it pulls people into the workshop. It motivates them to join, and it is personal. So proactive marketing is really the only way to maximize that capacity of your workshop. Yes, people are going to call because they saw that flyer in the elevator, but I've seen instant rosters fill because of one presentation or a certain adjustment to a passive marketing process. This kind of marketing really requires engagement from us to our potential participants. And again, both are good, but we're really striving for a hybrid of both strategies. So let's go back to that list, that brainstorm list of ways to promote our program, and identify which idea is a passive approach and which idea is a proactive or active strategy. All right, going back to our list, I made some of them a little bit more generic for the purpose of this exercise. But given what we've learned, let's go through each of these ideas and see if they're more of a passive approach or an active approach. So with email blast, you're emailing out to your leaders, maybe past participants, partners. We're going to put that as passive. Yes, it's great, it's important, it's needed to let your constituents know that you have an upcoming program happening or a workshop coming up and that they should let their other people know about it. But it's still passive. You're on the other end, one, hoping that they pass this email along, and then two, hoping that the people that they pass it on to resonates, and then it comes back to you. So putting that as passive. Presentations, we put that as active. You're going out there, you're going out in your community, maybe you're going to a clinic, having a meeting with providers, and you're having a dialogue, questions and answers. It's really great. I also put some passive stars next to it because I've seen plenty of presentations that people say, okay, that was my program, thanks for the opportunity, see you later. Where's the follow-up? Where's the dialogue? So be sure that there's a way to maybe pass out an interest form so you can follow up and have a conversation one-on-one instead of just this larger group. Press releases, free media, letters to the editor. Majority of the time that's going to be passive. I did put some active stars after it because there is a way to make it a little more engaging than a letter to the editor, which is really important. Don't get me wrong. Having a leader express their experience with these programs is really powerful, or having a participant share their testimony of how they benefited from this program, that's awesome. But the way to bring it up just a notch to make it a little more active or engaging is to incentivize it. You can add a line at the end saying, for the first 3 people who give our organization a call about this program and register, get a free relaxation CD, or maybe you waive their $20 deposit for the program, or maybe you just give them a free textbook that goes along with the program. but it's a way to incentivize them to give a call sooner than later. You know, that rule of seven, if they're incentivized to call and not put it off, to act on it and to take action, that's where it's going to bring it more to that active level. So consider having that incentive at the end of your advertisements or letters for the first 3 people to give us a call, blah, blah, blah. Various newsletters, passive, really important to get your information out there, important to support your partners and being in their newsletter spot and taking up some space there, but it's still passive. There's not a follow-up or engagement that happens with that. Targeted healthcare mailings, so that's when the clinic or hospital is identifying the key people that could use or utilize this program or benefit from this program, and then they send them a letter. It's a mix of both. It really depends on the process. Is there medical staff that's following up with those who received the email or the letter in the mail? So it's really dependent on the process. Referrals, either from a friend or a healthcare provider. Again, I put it as both. Really depends on the process. With healthcare referrals, studies show out of the Arthritis Foundation that patients are 18 times more likely to take part and sign up and register for a self-management education program when referred by their provider. They really take their word as bond, and so if you have a healthcare champion that is doing referrals, that's a really great relationship to foster and a really great process to continue to evaluate and stay shiny with that. Flyers and brochures, we're going to put that as passive. I know we love our flyers and brochures. They are really important as a part of that awareness piece, that we can put that out there and let that awareness compound about our programs. But they're just really hanging out. There's no follow-up, and we sit over here hoping that it resonates and that people call. I did put active stars next to the pharmacy. One of our program providers has the flyer and brochures in the pharmacy, and they have a great relationship with that department, where it says, you want to find out more, sign up on our interest form at the front desk. So they either go to the pharmacy cashier or whatnot. I'm not exactly sure on the process, but they have an interest form. So if somebody wants to be called by the program expert, the coordinator, the program provider of that workshop, they can give the pharmacy their name and phone number. So that's giving consent. And then the workshop coordinator would come around once a week to gather those names and phone numbers, to then give them a call. Hey, I saw you saw our flyer at the pharmacy. Great, let me tell you more about it. So there is a way to bring that up to the next level if you have the certain pieces in place. Personal invitations, it's going to be active. Personal invites, it's coming from a friend or someone that cares about you, so the credibility is really there. The purple passive stars, it can be really passive. Hey, I think you should take this program. Here's a brochure. And then there's no follow-up. So it can be a mix of both, but there's a lot of credibility in personal invitations. Tabling events, I put that as active, but you really have to have that interest form, whether it's at a health fair or you're setting up shop in the waiting room. People have places to go. The health fairs are always buzzing. Waiting rooms, they have to go to an appointment. So somehow get their name and phone number to have a follow-up conversation with them. Personal letters, that's a mix of both. It goes back to the personal invites. Super credible. Everybody likes to get something personal in the mail that's not a bill. So maybe there's an incentive to act on it, but really be thoughtful about your process. What's my follow-up? How do I re-engage with that person? I don't just put out 300 letters in the mail, but what can I do beyond that? Radio, passive. There's not a two-way dialogue. Yes, you're putting it out there. Yes, people are calling, maybe having a conversation if you're on a talk show, or if it's an advertisement, people are hearing it repeatedly. But where's the follow-up in that? Still really awesome. It's great to have that, but there's a little active or proactive measures that can happen. Social media, it's a mix of both. Primarily it's passive. You put out something to engage with the people who like your page or whatnot, but there's little follow-up. Now, how it can be active is you can have a direct message with with folks that are engaging with that post. Or I've even seen people who create a Facebook event for their upcoming workshop. And maybe a lot of people will say they're interested, and maybe some people will say that they're going, but then you have to have a direct message exchange back and forth with the people who are engaging with that event or that posting. You can't just put something out there and then log off and not log back in. So be sure that you're having or creating a dialogue between people who are using your social media. Calling people on my wait list, definitely active. They're there for a reason. They're just waiting for that upcoming workshop. Session 0, so that's when you do an informational session about the program. That's going to be active. These people are interested in the topic at hand. You're having a conversation back and forth. But if it's a larger group, you're going to want to pass out an interest form to then collect their names and phone numbers to not only register them later, but have a continued dialogue. Networking, yep, that's going to be a mix of both. Super great to talk about your program to everybody under the sun, but you got to take their info for that follow-up. Okay, so as you can see, sometimes it's clearly passive or it's clearly active, but other times we need to think about the process of that said effort and maybe make a little tweak, because that one little tweak can make all the difference between someone signing up or not. So if you're going through all this effort to do outreach in the community, be sure there's a way to further engage and follow up and reconnect to those who seemed interested. One way is having an interest form that's shown on your screen now. You can have that on your table or passed out at a presentation, but simply by collecting a person's name and phone number, you can go that extra mile in making that connection. And then this gives you the opportunity to thank them for attending your presentation, ask them about the rest of their experience at the health fair, and have more of a personal conversation about what they're doing for their health and how this program can extend that great work. You'll then be able to hear about what their thoughts are surrounding the workshop. Maybe they have some reservations or perceived barriers that you can help dispel. Or maybe they know people who could benefit, and it opens up a new door to serve even more people and a diverse population than you're already serving. But by following up and having this dialogue with someone, it can really help people identify and identify better with the program. And same goes for referrals or provider recommendations. And we plan to do an informational video on referrals as well as the registration process. But for now, be thinking about how do you engage with your community and how do you engage with your partners to reach potential participants. So interest form templates can be found on our WeHow website under your program provider and leader login section. But if you find yourself in a pinch, you can always just use a blank sheet of paper and put a couple headings on it. It doesn't have to be so formal. But there are also drafted PowerPoint presentations for your program to help you get started. Okay, so I'm going to leave it here for today, but are your thinking caps on? How lit is that light bulb? Did I get those wheels turning, or are you just feeling plain overwhelmed? Have you been yes-butting me this whole time? Like, yeah, that's a good idea, but, or I tried that and that didn't work. Well, that's okay. I want to hear about it. Tell me about your experiences. Tell me about your takeaways from today's video, and tell me about what's been working in your area, or tell me about what you'll tweak in your current plan to be more proactive. Share your experiences and let me know in the comment section down below. Use that comment box to share so we can have an archived dialogue and continue learning from one another. The last thing is, for more ideas, advice, and strategies, you can check out our newly updated marketing toolkit under the Planning Your Workshop button. Thanks for tuning in today. I had a lot of fun making this video, and I hope there's many more to come.